Thank you all so much for joining us tonight for a community conversation on addressing homelessness in Bloomington. My name is Faith Jackson, and I am the Racial Equity Coordinator for the City of Bloomington. And tonight we're going to have a conversation that really speaks to some of the significant challenges that we see in addressing the unsheltered population that have sort of increased in nature because of the COVID-19 pandemic. In the city of Bloomington, we recognize that both addressing the needs of the unsheltered community and also addressing the underlying issues of homelessness really requires a human-centered approach. And it also requires a great amount of collaboration and partnership across different agencies. And so to that end, tonight we are bringing together our residents and our community partners and also some representatives from the state to have a conversation about what are we doing and how are we working together to address homelessness in Bloomington. So to start, I am going to acknowledge this public notice. And so just so that you know that photos and video are being taken. Because this is a public event. And so by attending, you're consenting to the city's use of images of you to publicize this event and for other purposes. So if you have your video turned on or if you're providing comments in the chat, just know that that information may be collected. So just want to start with that acknowledgement. Also, I would like to just sort of give you a brief overview of the agenda today, so that way you'll kind of know how the conversation will flow over the next 90 minutes. We will start the program with a welcome from Mayor Bussey and have some opening remarks from him, and then we'll have a panel discussion that will be facilitated by Heather Worthington, our interim community development director. After the panel discussion, there'll be a Q&A session. So there'll be an opportunity for those who are attending today to provide some comments and or questions to panelists, and then we'll close it out with some closing remarks from any elected officials who are attending the meeting tonight. And so I want to get some housekeeping things out of the way before I turn it over to the mayor to provide a welcome. The first thing that I want you to know is that everyone has been muted upon entry. So you may notice if you try to unmute yourself that you're not able to. And the reason why we're doing it is just to make sure that we can really facilitate a smooth process here tonight and not talk over each other or anything like that. But when we get to the panel discussion and there's an opportunity to ask questions of panelists, you can utilize the chat to do so. So please do feel free to utilize the chat throughout the meeting and also during that particular part of the session. And also if you are calling in, right? So if you're not utilizing a computer and you want to add comments or questions to the conversation, please dial 952-563-4530. And you can just leave 30, and then you can just leave your a voice message with your comment or your question, and then we will add those into the chat for you. And again, just another reminder about the public notice and pictures being taken and comments being recorded and notes and things of that nature. So now that we have the meeting protocol out of the way, and that's always the fun part, right? I am going to turn it over to Mayor Bussey to give a welcome and address the audience. Mayor.
Good evening, everybody. Thank you, Faith. Appreciate it. Good evening, everybody. Welcome. I really do appreciate you being here with us tonight for this important community conversation. It is great to see so many people here tonight, and I appreciate that you've made it a priority. There are other things you can be doing with your time right now. I admit that, and granted, that list is smaller than it's been in the past and smaller than it typically would be. But you could be reading a book or binging on Netflix, taking a walk on this beautiful evening. But you chose to be here tonight, and I appreciate that, and I respect that, and I'm glad to see you here this evening. I'd really like these community conversations. We've hosted a few of these now on a variety of different topics, including things like sustainability and race in the community. They've all been very interesting and thought-provoking and good conversations among the community. And if you've joined us in the past, you know that the title pretty much says it all, what this is. It is a community conversation. It's a conversation between community members on, as I said, an important community issue. And I think that's important to note, that this isn't a debate, this isn't a shouting match, we're not going to solve this. This is a conversation about an important issue in our community. And I'm glad that we can be doing this. If back in January we had kind of laid out a list of possible topics for our community conversations, I can honestly say that I don't know that housing insecurity or homelessness would have made that list. Now, that's not to say that homelessness is not an issue in Bloomington. It is, and it has been, and Our friends from Oasis can share that with us, absolutely. But I'm pretty sure that pre-COVID, the conversation probably would have focused around more broadly around the topic of affordable housing. And I think, frankly, it's an easier issue to talk about in a lot of ways. Now it's not easy, but it's easier. And the solutions, frankly, are a bit more manageable. And we've actually made good progress on our affordable housing goals here in Bloomington. We still have work to do, but we've made good progress. But homelessness, obviously, it's a different topic. It's a topic that's come to light for a variety of reasons that I know we're going to go over this evening. And it has its own specific set of challenges. It is misunderstood in so many different ways. It's a frightening topic for a lot of people in the community. And frankly, there are no easy solutions. But to make it any progress at all on this, to move the needle at all, we have to be comfortable talking about it in our community. And as I said, talking about it in a conversation, not shouting, not via Facebook comments, not via tweet, but actually talking. Ideally, face-to-face. This is going to have to do for now, but ideally, we need to have these conversations face-to-face. We're not going to solve homelessness in Bloomington here tonight, but I am encouraged that we're having this conversation as neighbors, that we're sitting down. And I'm really looking forward to hearing what our panel members have to say. I'm looking forward to hearing what all our community members have to say. Thank you very much for being here this evening. And I'm, as I said, looking forward to where this evening takes us. Thanks so much for being here.
Thank you so much, Mayor Bussey, for that warm welcome. With that, I am going to introduce the panelists, and then we're going to turn it over to the panel so we can get this conversation started. So tonight we have with us David Hewitt from Hennepin County. We also have Michael Huffman from St. Stephen's Human Services, Nicole Mills from Oasis from Youth, Erica Brown from the City of Bloomington Police Department, Representative Michael Howard from the Minnesota House of Representatives. And our moderator for tonight is our very own Heather Worthington, the Interim Director of our Community Development Department. So at this point, I am going to turn it over to Heather Worthington to present the panelists and to get the panel discussion started. So Heather, feel free to take it away.
Great. Thank you, Faith. Good evening, everyone. We have a great panel this evening, and I'm going to ask David Hewitt to kick us off this evening, give us kind of an overview of the Hennepin County shelter system. And then we're going to go into a panel discussion with the rest of our panelists. So I'll call on you. And I think we're going to ask each of you to take about 5 minutes to describe your programs and services that you're offering. And then we will have a panel discussion based on the questions that we receive in the chat this evening. And so if you have a question for anyone on the panel, you can just submit it through our chat function. If you don't have chat, you can submit it through a phone call or other methods that you may have of getting in touch with us this evening. And I know Faith is going to take that set of questions we receive and put them in the chat, and then we'll be using those for the Q&A afterwards. So David Hewitt, would you like to kick us off this evening? Thank you.
Absolutely, Heather. Thanks very much. And I'll just try and very briefly perhaps summarize kind of the situation as it stood pre-pandemic, and then what we've seen play out over this year to help set the context for this discussion. And then happy to engage with all questions and keep it conversational beyond that point. If I go back to sort of the beginning of March of this year, what we would typically see is about 1,400 people in homeless shelters on any given night, and a little over 600 people recorded as being unsheltered on any given night. Another 1,000 or so in transitional housing, which also counts as homeless for HUD standards, gave us an annual point in time count for the federal government of about 3,000 people. And that had been constant over the last 5 years, but with some pretty big shifts within it. The numbers of families with children had been coming down year on year, but the number of single adults had been going up, and that had been driving an increase in unsheltered homelessness. Within that, there are other pieces we can point to, the obvious intersection with the opioid epidemic that's taken such a toll on parts of our community. Also playing out, so to the point already made by the mayor, some of the complexities that lie within this challenge. Now, one of the things to point out when I say 3,000 each year, we were seeing the same number. It is not a static number, of course. When we looked at the number of people who became newly homeless in Hennepin each year, it was around about 8,000 to 9,000. So what that meant was to get the same number year on year, you needed 8,000 to 9,000 people also to exit homelessness. And this is one of the things that I think is poorly understood about the challenge of homelessness, is that certainly while there are a relatively small number of individuals who are long-term homeless, and a very high priority for us to get into housing and to keep that. We have a much larger, constantly shifting population who may become homeless, be homeless for a short period of time, exit, may return, may not. In actual fact, our single adult shelters would see about 5,500 people over the course of a year, half of whom would stay for less than a month, would leave and would not return. So that's the kind of movement that was under the surface of what looked like a fairly static challenge. One other just big piece of context that is really important here before I get into this year is the underlying cause. There are many challenges at an individual level, but one thing that all of those people have in common, 9.5 out of 10 of those 5,500 individuals, is a desperately low income. Incomes below 30% of the area median income, which is the lowest kind of housing policy one category, means about 21,000 for a single adult, or below, and often far below, about 30,000 for a family of 3 or 4. So that's who experiences homelessness, but not everybody in that income group experiences homelessness. And this is key. We actually have about 74,000 households in Hennepin County in that income bracket, but only 14,000 units of housing that are affordable to them. So what that tells you is that we have a huge swathe of people out there who are not literally normally find themselves on the streets or in shelter, but who are right on the precipice at any given time, who are struggling to meet basic needs, who are overcrowded, who are doubled up, who are living in very difficult conditions and just outside of our line of sight. This is relevant as I come to this year, because essentially what we always have is the visible piece of homelessness is kind of to use a cliched analogy, is the peak of the iceberg. It's the bit that's sticking out of the water, but there's this huge mass just underneath. And it doesn't take a lot for shifts to bring parts of that iceberg back up into the surface. And we've seen a lot of that this year with the pandemic. So turning to the pandemic in this year, March 17th, Hennepin County declared a state of emergency, really implemented 3 strategies. One was to identify the folks who were at greatest risk of medical complication or death from COVID. We were seeing what was playing out in Italy. The first question with our emergency management folks was, how many people do we have in shelter who are age 60 and above, and how do we get them out? And this is obviously where I think bringing, as Lucy, as you said, kind of bringing this up the list of topics for a public discussion here, we turned to hotels in both Bloomington and the city of Minneapolis as kind of, in many ways, ready to go settings that were ready to receive people, to accommodate people. And we started staffing them up and bringing seniors out of congregate settings and into those spaces. That was our first strategy. The second was to bring down the overall risk of COVID for anyone experiencing homelessness. This was done in part by deconcentrating shelters. That first measure allowed us also to drop the numbers, introduce social distancing, make them 24/7, and also set up sites for isolation for anyone who did test positive, so we can get them somewhere where they can recuperate safely, reduce the risk of transmission. And the third was really to reinforce the system so it could keep serving people. So we'll have 200 new shelter beds coming online in new CDC compliant shelters this month. One that opens this weekend, very excited about, focused on the Native American community. I'll be visiting tomorrow. And a whole range of other tactics around added cleaning, added staffing to services to make sure that they can continue serving people. Early in the pandemic, we saw a shelter in Las Vegas close down and 500 people relocated to a parking lot. We saw shelters on the East Coast coming out with positive tests with hundreds of people, and then positive tests coming out in the 40-50% range. We are in a difficult spot as a community across the state right now with transmission rates, and that's affecting all of us. And it is affecting people experiencing homelessness. What I will say is over the last 8 months, the steps that have been taken, including the steps we've worked closely with colleagues in Bloomington PD, Bloomington City Council, where sites have been stood up there, have been incredibly effective, and I believe have saved lives, have really helped us keep some of our most vulnerable residents safe. As we look to the next phase of this, we know that hotels aren't a financially sustainable solution, and indeed they're not a home. People don't have a lease, they don't have the security there that we want them to have. So we're really trying to pivot to getting folks out and into their own housing. And we've been wrapping a team around folks in our sites. Everybody in this sector knows that that's always the goal. We got pushed deep into crisis management by just something unprecedented globally this year. We're trying, and I think making great strides to get back to that strategic focus, get folks out, get them into housing. I'm actually pretty encouraged that I think we will see some folks who have been languishing in our shelter system far too long, seniors, people with medical underlying conditions, should never have been that. Let's get them out, let's keep them out, let's make sure they don't return. And I think we have a great opportunity to really transform our system in the months ahead. So that's some of the work we've been doing. Plenty more I could say. Let me hand back to you, Heather.
Thank you, David. That's really a helpful overview. I'm going to call on Michael Huffman next from St. Stephen's.
Yeah, good evening, everyone. Thank you for participating in this conversation. So my name, as Heather noted, is Michael Huffman. I'm the director of our Outreach and Shelter program. And we are currently in partnership with our Saviors Community Services to provide shelter at a local hotel in Bloomington. And I also want to just thank Heather for the invitation to speak tonight. St. Stephen's and our Saviors center client self-determination in all of our work. And you probably are wondering what that means. For us, it means that we don't, for example, make goal plans for the households we work with, but rather support them in creating their own goals and subsequently support them in working to achieve those goals. Key evidence-based philosophies we operate under are harm reduction and housing first. And I say this as kind of a backdrop for the things that I'll probably be asked about and why my answers may look different than some other folks' answers that are on the panel. And so I think it's important to set this groundwork so that we have a shared understanding in how we come to the work. So harm reduction seeks to meet people where they're at and uses their own choices to support ways to increase their safety and reduce harm, particularly when it comes to physical and emotional safety. And often we address their chemical and mental health concerns or challenges through that process as well. Historically, folks receiving housing support have needed to be housing ready. Housing first, though, says that housing should be the first objective, and from that stability that offers, other goals can and will be pursued. Some folks hear housing first and believe that means housing only, but our programming provides support for our participants to identify how they can be safe and successful in housing through regular case management visits and support. In addition to our shelter program, which brings me here tonight, St. Stephen's has the longest running street outreach program serving all of Hennepin County, engaging with many of the individuals that David referenced, folks that are staying outside in places not meant for human habitation. We also have a large housing department with short-term, mid-length, and permanent supportive housing programming. In regards to our shelter specifically, each person who comes to our shelter is connected with us via a centralized access point in Hennepin County called Adult Shelter Connect. Traditionally, folks would be able to stay for a minimum of 30 days as long as they're meeting some basic benchmarks, primarily behavior expectations. Each participant completes an intake, and as part of that process then agrees to some community-wide behavioral expectations. Simply stated, they commit to acting in a way that keeps themselves, the community, and staff safe. In times of COVID, this has also meant that we set the expectation that participants won't have outside guests at our hotel that we are operating. Our shelter program's primary goal is to provide a safe and warm space for individuals accessing that shelter. In addition, though, we provide advocates who work one-on-one with clients to support their move out into more stable opportunities. In April, we moved into a hotel, as David mentioned, to support the CDC and MDH recommendations to providing clients an opportunity to social distance in a way that our congregate shelters didn't allow. We have, and especially now with the recent uptick in cases statewide, seen the benefits of this model. Additionally, we supported the Shelter Collaborative in Hennepin County by adding bed capacity at a time when many congregate shelters were decreasing capacity to comply with the distancing guidelines. So targeting unsheltered individuals was part of the project goal from the beginning. Thank you.
Great, thank you, Michael. I'm going to go next to Nicole Mills with Oasis for Youth.
Hi, everyone. Thank you, Heather, for the introduction, and thank you for having Oasis to be part of the discussion. As many of you on the call know, Oasis has been around in Bloomington for 10 years. We're celebrating our decade birthday. Oasis, because we have been here, we work to be the trusted resource committed to serving youth in Bloomington, Richfield, and Edina. We work with youth ages 16 to 24, and we don't ever turn anyone away. And we are here to address issues of youth poverty and housing instability. We at Oasis believe we're always the right target, the right mix, the right place at the right time. And like Mike said, that individualized case management. We really work on issues of prevention and appropriate interventions and support to prevent long-term homelessness and generational poverty and just the traumas of homelessness in general. We are also the only resource that is available to youth in Bloomington, Richfield, and Edina. And we were here and will continue to be here because we know that poverty is increasing in our communities. And it's this homeless system is really complicated. So you'll hear David talk and you'll hear Mike talk and you'll hear all these panelists talk. And it's really tough to be homeless. It's really hard. It's really hard to live in poverty. And each one of us have these different moments of understanding and interpretation and how we understand the system and how people get services. So a lot of times, and this might sound funny, but a lot of times our young people don't classify as fully homeless, sometimes making them really somewhat invisible. When we talk about visible homeless, invisible homeless, like to David's point, that's sort of tip of the iceberg. Our young people often you're not gonna see them, they don't wanna be noticed. They really do their best to stay out of the homeless system. So we're really working a lot of times with a lot of young people on the edge of homelessness who are couch hopping, staying doubled up, maybe staying at their friend's house, things like that, but still need supports. And also thinking about our young people in our community, it really takes a lot of effort and vulnerability to even ask for help. So to even walk through our doors pre-COVID, to walk through our doors, to ask for help, it's really a humbling experience. It's a humbling experience to ask for help no matter where you are. If you're in the hotels, if you're in shelter, if you're walking through our doors because you need help with food to meet your rent, whatever it might be, it's still a very vulnerable experience. I just want to remind people that it's hard to ask for help. And we also are here because in the suburbs, it's challenging. We have really limited transportation. We have limited access. Bloomington, Richfield, and Edina, we're sprawling. It's a huge community to serve. So it's really hard to get the services to the people and the people to get to the services. Another issue for why we're here is the spike in unemployment due to COVID. Pre-COVID, 70% of our young adults were working. They were working, of the 70%, 25% were working full-time. And again, as David already pointed out, it's really a simple math problem. Our youth's incomes don't meet the rent and can't meet their housing payments, whatever that setup might be. So our young people are really on the edge of homelessness, and particularly those who are most impacted by COVID-19 in the retail and restaurant industries. What we do to the crux of how we serve our young folks are 5 key program areas. We have our drop-in center. Our flagship drop-in center is located at Oak Grove Presbyterian Church, just right down the street from City Hall. And pre-COVID, that was a safe place for young adults to just come and be who they wanted to be, to get connections to caring adults, basic needs, laundry, food, whatever it might be. And then we helped navigate youth to what community resources they need. Our outreach team, which is in our 9 area high schools and alternative learning programs, including Normandale Community College. And our outreach team, this year we've really built out to be our mobile Oasis response. Maybe some of you on the call have even are supporters and helped give to our mobile response unit. We just got a minivan and we're outfitting a large cargo van to literally be a mobile office to really address some of those issues of transportation, access. So we're gonna have an office on wheels, right? Thank you, Krista, for the claps. We literally will be able to take take our show on the road, which we're really excited about. We have our Workforce Innovation Program, which many of you are familiar with our Mall of America program, where we're on site at the Mall of America to provide support to their young employees with all their issues in their lives outside of work, so they're able to show up ready to work. Pre-COVID, I hate to say that, I'm sorry, but pre-COVID, our young adults who are connected with us were working up to 14 months, which was a really good result for first-time employees. So we were having really great outcomes at the Mall of America and continue to have a really strong partnership with our young adults who are working out there. For housing supports, we do not provide shelter services. We are conduits to the very complex systems. So we work with the minor shelter system, so 17 and under. We work with the youth shelter system, 18 to 20. We work with the adult shelter system in all of its ways that we'll learn about this evening, 18 plus. And we also work with the family shelter system, which is also a whole other complex system, right? So when we think about people going to shelter, it's not like you just pick up the phone and all of a sudden you're transported into a room. It's really hard and it's complex, and oftentimes it's full, or oftentimes you don't qualify. So we help walk people through those systems. And we also do eviction prevention. Our friends at Veep, our local food shelf and rental subsidy folks in 2020, they spent $150,000 in rental subsidies in 2019. In 2020, they estimate to go over $3 million. That's a crazy amount of money for our community, but just such a good resource for us in our service area. We help people with traditional housing options, like our partners on the phone, and then we have a small rental subsidy program. So it's really, so we do all those housing supports. And then one of my favorite and I think most key component of our programming is our youth voice. We have a youth internship program, youth advisory board, and then we were planning on having internal youth employees in 2020, but we hope to launch that in 2021 once we reopen. So we're really excited about those pieces. And really, we were part of Bloomington, Richfield, and Edina, and we still are, and will be in our working, the current issue that the conversation is about. We hope to be part of the solution and part of the partnerships. And we know that it's moving unhoused folks from invisible to visible in our community, and it's a change. And Oasis just really wants to help be part of that solution. I know it's a really big strain on our community right now, but we also just know that those folks that are here are still part of our neighbors and our community, and we're just happy to be here to help. So thank you.
Thanks, Nicole. Next, I'm going to ask Erica Brown with our Bloomington Police Department. That was a weird little slip there. The Bloomington Police Department, and she's one of our crime prevention specialists.
Hi, thanks, Heather. Like she said, my name is Erica Brown. I'm a police officer with Bloomington. And so I'm currently assigned in our crime prevention unit. So basically, so part of my job duties in crime prevention is that I deal with all the businesses in Bloomington. So I'm the liaison, whether that means they need, some kind of assistance from the police department, some kind of follow-up question on a call, some kind of safety presentation, safety tips, some proactive ways on how they can improve their business security. So I'm kind of their link to the police department. So part of the reason that this got brought up to my attention, so earlier this year, kind of right when COVID hit, I look at calls for service every day when I come in. I always run calls for service. What are my partners doing out on the street? Where are we going? So dealing with all the businesses, I always, especially track all the businesses in Bloomington. Are we going there for alarms? Are we responding to suspicious people? Are there thefts from motor vehicles? Just things that I can follow up on and work with that business just to see what we can do to try to cut down on some of the crimes and the calls for service. So earlier this year, we, tracking all the calls and where my partners are going, we saw a big increase of calls for service at certain hotels. So of course, having 47 hotels in Bloomington, that of course comes just more people staying in Bloomington, more crime. So it fluctuates each month, each year. But we really saw a big spike starting this spring. So probably about in the month of April, and then kind of some of the other months where we've noticed other groups. So just kind of digging into it, we've discovered that some of our hotels were housing homeless groups. So that kind of began the partnership with general managers of hotels, with the shelter that was in the group, like Michael Huffman. We reached out to some of the shelter staff, some of the shelter managers, some of the other groups that you'll probably hear about later in this meeting that we reached out to. So really, with the police department, we began a partnership. What can we do to cut down on some of these calls for service, these calls that we are seeing? What are some things that we can talk through with the general manager of the hotel, with the shelter staff? What are we seeing? What are ways that we can work together? Different ways that we can kind of change our procedures on how we do things, change some of the protocols and how we're responding to hotels, along with working with the general managers on ways that, how can they secure the building better? How can they make the building a little bit more secure? What are the type of calls that we're seeing? What type of behavior is it? Is it something where it's kind of an operational type thing that, staff or owners of the hotel, that's something that they have in their control to help decrease? Is it the type of clientele? Is it the activity? Are there some kind of rules or different things that we can put in place to decrease some of this activity? So a lot of it has really been problem solving, trying to be creative, understanding that, and I think Michael Huffman mentioned it, that, we may see situations a little bit differently, but obviously our end goal is to keep everybody in the city of Bloomington safe. Whether they're, it's a business, a client, a homeless person, staff, whatever the situation is, our ultimate goal is to keep everybody safe. So I think one of the biggest things is some of the different kind of shelters require different types of response from us, different types of protocols that need to be put in place at that certain hotel or homeless shelter. And so like with the Holiday Inns, for instance, I know that was a Hennepin County, two of the Hennepin County shelters. So working with the Hennepin County staff, working with Hennepin County security, we basically put kind of a program into place where we triage certain calls, and we made kind of a big plan on how to respond tonight, how to respond to emergency calls. So the staff there would basically take control of most of the calls in that building, and then they would call our dispatch, and our police would respond if they see it necessary. But really, it's a way to try to mitigate these issues at our hotels involving some of the homeless shelters and trying to decrease calls for service. I know kind of on the business end, with Heather and some of the other staff or city employees, we meet every week. And really, we had a variety of meetings. Some would involve, the police department with other city departments. Some meetings would involve general managers and owners of hotels, along with shelter staff, to try to work with specifically on certain hotels. And then some meetings would include, other, like Hennepin County or kind of the state or other divisions, just because homelessness is an issue, an increased issue that we're seeing across the state of Minnesota. So we have all entities involved. We're meeting weekly, and it's just a way to work together to try to keep everybody safe and to, obviously maintain shelter for these folks, decreasing crime, and then trying to help with the spillover. We're seeing with this increased homeless population in the city, we're also seeing some spillover on the streets of Bloomington and other businesses and residential areas. So we're really targeting that too. Just because we know that, this is kind of a newer, at least with the police department, with the city of Bloomington, we haven't really dealt with a large group like this of homeless. So we're kind of taking it, week by week. But it's really been helping us, giving, me being kind of the point person, giving direction to our police officers on the street on how to, after we meet with, with Comfort Inn or with St. Stephen's, it kind of gives me a better grasp on their needs and what they need from us as a police department, how we can respond differently, how we can interact, basically work together to make this work out better in our city. So
Great. Thank you, Erica. And thanks for everything you're doing to assist with the problem solving here. It's been great. Last but not least is Representative Mike Howard. And I especially kept you for last, Representative Howard, because I wanted to kind of get the overview at the state level and kind of the overarching policy sense that you bring to this issue. And so, not to put you on the spot, but I'd like it if you could help us just to understand the state's role in all of this and some of the things that you're working on right now from a policy standpoint as we go into the next session. Thanks.
Absolutely. I really appreciate the conversation tonight, and I'm hopeful to learn quite a bit about how we at the state level can support the amazing work that's happening in our community and across the state. And it's clear to me that the state does have a big role to support the efforts that are happening at all levels of government. I don't think I'm telling you all anything that you don't know, but we had a housing crisis before this pandemic. In 2019, there was a 10% increase in homelessness in our state. And again, that's before the pandemic. 1 in 4 Minnesotans are struggling to afford their homes in our state. And the link between housing security and our public health, which was apparent before, is being shown so clearly in this pandemic. And just to underscore the vital importance of housing security, I just saw a study today that was done across the country in states that have lifted eviction moratoriums, where they've seen floods of people hit the streets and homelessness increase. That study of 27 states estimated 433,000 excess cases of COVID and over 10,000 excess deaths from COVID, just as related to people being homeless and not having housing security. And so the stakes couldn't be higher. And what I will say, though, is I think that through this crisis, there is an opportunity to shine a light on a crisis that was here before the pandemic and bring leaders together to deliver some of the systemic change we need to say that this isn't okay. We need to build a system throughout our state where folks have housing security and we address homelessness. So to set some of the stage of where we've been, as someone mentioned, we've kind of been in crisis mode this year since the pandemic happened. And in the housing space, early on, Governor Walz instituted a moratorium on evictions, and he's maintained that power through his peacetime authority. And thank goodness that has done well to keep some folks housed, although that eviction moratorium did nothing to cancel rent. Folks still owed their rent, and because of the huge rise in unemployment and economic costs, that has led to increased homelessness and all kinds of challenges for folks. And so the legislature did come together and pass some resources in terms of helping to keep our homeless population safe or quarantined, for example, if they came down with COVID. But it's a frayed system, a patchwork system, and by no means enough. The other action that Governor Walz took was to approve $100 million in housing assistance to help folks cover their rent, their mortgage, their utility bills. And those to me were patchwork crisis mode types of solutions, and even that wasn't enough to address the need. And we're coming to a precarious moment in time. With COVID surging, much of the resources that were passed and sent to us from the federal government will go away at the end of the year. We desperately need the federal government to take action on economic assistance, housing assistance, a whole host of things. And it doesn't appear that that's going to happen by the end of the year. So we face an important moment. One bit of good news today at the state level, we had an updated economic budget forecast that actually showed an improved budget situation, a short-term $600 million surplus, and a reduced deficit in the out years. And I'm hopeful that does provide us with a little bit more space to provide some injection of both kind of immediate funding to help continue housing assistance, but also needed funding to help on the service side, on the shelter space side. I mean, just because the scale of the investment, I mean, we need more investment on services, on physical space to preserve affordable housing, especially that's deeply affordable. So, you know, I really view our role at the state level right now is to address our crisis that people are facing as a result of COVID, while at the same time shine a light and try to move forward on sort of the big structural long-term changes we need in housing. And so I'm hopeful we can have and we're already starting to a conversation about both of those things, because I think we need to do both at the same time. Thanks, and look forward to the discussion.
Wonderful. Thank you, Representative Howard. Just a friendly reminder to everybody, put your questions in the chat, and then we will have a Q&A here. I know there's one question that we can answer right away. There's a question from David Fay to Nicole. What Bloomington organizations are addressing the needs of adults 24 and over facing homelessness and housing instability?
Right. I think when we talk about gaps in services, we don't have a service provider that's dedicated solely to issues of homelessness in Bloomington, Richfield, and Edina. We do have VEEP, which is our area food shelf and rental subsidy support. I think VEEP is an outstanding organization and an outstanding partner. And of course, we have our city services. There's some great City of Bloomington services, some food support, loaves and fishes, things like that. But for traditional homeless services, there's not an agency like St. Stephen's or Our Saviors that's here in Bloomington or in Richfield or Edina, right? I mean, I think that's one of our suburban issues across the entire metro, is that there's just not the same level of service inside of our suburban communities as there is in our metro counterparts.
Yeah, thank you, Nicole.
Yep.
And I think that it bears repeating that one of the things we've heard is that while homelessness is not a new issue in Bloomington, it is an issue that has grown a lot in the last several years. And so I think it's an issue of kind of building capacity and awareness of our unsheltered population and their needs. Faith asked me to remind everyone that if you have a question and you are unable to use the chat, you can call in to 952-563-4530 and use the voicemail to add comments or questions. So again, that's 952-563-4530. A quick question here from Krista. The suburbs are not immune. We just talked about that. But it looks different. What is the City of Bloomington's plan to address suburban homelessness? And I guess, I mean, I'll jump into that one really quickly, and Mayor Bussey, if you have some thoughts to add as well. I know that one of the things that the city has done in the last couple of years is the Opportunity Housing Ordinance to encourage developers to build affordable housing. I think one of the real challenges for building affordable housing generally, and this is a national issue, is that these projects often don't pencil. They're very expensive to build, and they don't have a return on investment because they are really the most affordable units would be at that 30% of the area median income or lower. And I think, as Michael Huffman said earlier, we have quite a few residents, I know David Hewitt said this as well, but quite a few residents living below that level, earning more like in the $20,000 a year scale. And it's very challenging to construct housing for that population because there is not, there aren't many developers who are willing to go at risk to build that kind of housing. So it requires a fairly heavy subsidy. When you consider that a typical unit in the Twin Cities right now, just to give you a little bit of context economically, a typical unit would cost somewhere in the $250,000 to $300,000 range to build right now. And that's a market rate unit, but that's just a construction rate as well. So you consider all the labor that's involved, the materials and everything. That's kind of a typical range. So if that's the cost for that unit, it can be very difficult to find ways to make that more affordable from the construction and development side of that. Anybody else want to add to that? Mayor Busse.
Thank you, Heather. If I could just jump in. I think it was Representative Howard made the point earlier, or somebody else did, that basically, we're, like everybody else, the city of Bloomington is kind of in crisis mode right now. We're reacting. We're trying to doing what we can to help people where they are right now. And a couple of ways that we have done that specifically, our HRA provided a financial contribution to VEAP for rental assistance. And I think the city did as well through our CARES dollars, very similarly as well, to try and help people pay their rent and get ahead of this. And it's our opportunity housing ordinance and the work that we've done on affordable housing. Heather is exactly right. We do well at the 60 to 70% range of AMI, but when you get into that lower number, you get into 30, 40, 50%, it's just very, very difficult to do. And I appreciate the thought or the question about, well, what is the city of Bloomington doing? And I often reply to people, this isn't a city of Bloomington issue. This is a Twin Cities issue. This is a Minnesota issue. This is a United States issue. And for Bloomington to act alone, it would be like Bloomington acting alone, like trying to control, emissions or trying to control global warming. If we do it on our own, the global warming doesn't stop between here and Edina or here and Eden Prairie. It requires a regional solution to this. It requires regional thinking, regional strategy, and regional solutions. And without that, it's just tilting at winds. Basically, we're just putting our fingers in the holes in the dam as it pops up, but we aren't really doing anything. We've got to pull this together as a region and as a state. And that's why I'm so glad to see Representative Howard and Senator Wickland here this evening, because they know full well, along with the rest of us, that this isn't a Bloomington issue. This is a state of Minnesota issue, and we've got to deal with it as such.
Thank you, Mayor Busse. The next question is from Gina Lemon. Can the state provide additional tax cuts for those who provide housing so that we can keep people housed? Could be a win-win for those who are providing housing and face the possibility of not receiving payment from residents. How are we getting creative? Who would like to take that one?
I can take that one. It's a good question, and I appreciate the prompt. How are we getting creative? I think that's a good question, just in general, about how we're addressing policy solutions in what's in a completely different environment. So we should try to think outside the box. In particular, on the housing assistance side, we are actively considering models that would reduce barriers to help cover rent by, for example, having landlords be able to apply directly for assistance. If we do that, we need to make sure that renters have protections. But we are looking for that win-win, where we are making sure that those that are providing housing are covered and those that need housing can access it and afford it. And so I think that, and the other thing I'll mention about that is that maybe how we secure some sort of political will to deliver on some of this. The Senate majority, controlled by the Senate Republicans, the reality is they've been more interested in prioritizing landlords than renters. That's been kind of their MO through this process. And I think that in general, we need to find solutions, just as you said, that are win-win, so that folks can stay housed, and we look at the whole economy of the situation. So we're trying to get creative, and we'll probably need to be to reach some sort of solutions that actually pass and get all the way across the finish line.
Thank you, Representative Howard. Anybody else want to chime in on that one? David.
Yes, a very similar point, but one that is worth making. So, I mean, the rental assistance piece is huge. This potential wave of additional homelessness is huge. We actually have, which is, I think, counterintuitive when people see what's been happening this year, about 200 to 300 fewer people in family shelter than we did this time last year. And that's been true throughout the pandemic. Now, our best read on that is actually that it's the eviction moratorium has been holding back homelessness that would have occurred in a normal year. So far from the pandemic increasing homelessness for families with children, we've actually seen a decrease because of the eviction moratorium response is what I believe it's coming from. We took 15 million from the federal CARES allocation to Hennepin County, also 6 million from the state, bolstered that to make it available to help people keep up with their rent. And we actually made exactly the change that was just being talked about a month ago to allow landlords to apply directly, just because we found that tenants, for a variety of reasons, people in trauma and crisis are prioritizing different needs, weren't necessarily reaching out and getting the financial help when they need. The reason I wanted to highlight this actually is because we need applications by December 7th. So if anybody out there is struggling with rent, go to the Hennepin County website, because the federal dollars go away on December the 30th, as has already been mentioned. So we have huge concern as to what follows behind that, because at exactly the point that we're heading deeper into winter and deeper into this crisis, the resource that's been available to enable us to support so many of these initiatives, including the hotels, which are, those operations have been costing around $12 million a month to Hennepin County. All of that funding stops on December 30th. So trying to encourage people to get caught up with their rent right now. And if landlords need to reach out to get help, then they should do that.
Thank you, David. And I should mention that the city has been concerned about landlords who aren't being paid, who have potentially have mortgages outstanding. So this is an ecosystem, right? Understanding that people have liability on their side if they're renting units or if they are landlords. And so there's a relationship there that can't be ignored. The next question from Aaron Lind was, how many hotel properties does Bloomington support for homeless? How many more is the city county looking to adopt in the city of Bloomington? Who funds the additional law enforcement if necessary to support the additional calls and needs to the hotel properties in recent months? I'm going to take a first cut at this, and then I'm going to hand it to Erica and then to David. So there are 3 hotel properties currently that have contracts for short-term housing for unsheltered people. And typically these are people who are medically fragile or vulnerable by virtue of their age for COVID. The Comfort Inn, the Holiday Inn Express, and the Holiday Inn Airport are the 3 hotels. The city right now is working with Hennepin County for both the Comfort Inn and the 2 Holiday Inns to have the county provide additional security at those locations. And that is helping to augment the police department's role. There is not, right now, there is not a payment in lieu, for instance, for the law enforcement costs outside of that. But we have seen that the on-site security at those locations has been very helpful in reducing the number of police calls over the last several weeks. So Erica, would you like to say anything else about that?
Yeah, I mean, we do, since these shelters did come into place, we do spend more time at certain locations, not just hotels, but, you know, different stores in the area, other businesses, Walmart, that is related to the shelters. And, you know, as far as, I mean, we luckily right now how we're staffed, we have enough officers, you know, at any given time. You know, we have a minimum that we go by of officers per day, per shift, how many we need on the street. So we're still able to maintain our high volume of calls with this amount of staffing we have. One of the nice things too is that we will sometimes designate officers to just do some extra patrolling on the American Boulevard area. So lots of times officers can then be a little bit more proactive when they're just, instead of always responding to calls, we have officers driving around, just doing some proactive work. So we're still able to handle the call volume we have at this time with the officers that we have on at any given time. So it's just, and like Heather mentioned, with the added with security at some of the hotels, and staff dealing with the issues before calling us. We've really, once we've worked with security and with staff, we have seen a decrease in calls. So that definitely does help our call load as well.
Thank you, Erica. David, do you want to take the second part of this, the second part of the first part of the question? Is the county looking at more hotel rentals in the city for homeless people who are vulnerable?
We are not looking at acquiring any additional hotels or moving services into any additional hotels in Bloomington at this time. Indeed, we are advanced in discussions with, actually as of today, we've closed on 2 small sites facilities in Minneapolis, one of which is a former hotel, the other a former treatment center. And we are in negotiations for 2 further, again, smaller sites. Our goal is to, wherever possible, to transition folks out of leased arrangements. This is financially unsustainable to us. The federal dollars go away December 30th. Communities across the country are withdrawing altogether from operations that are this costly. We're committed to keeping people safe, as we can't make that shift in winter, even if we don't have federal or state funding to support it. We know that that's something we need to do for our most vulnerable residents, but we are looking at ways to bring down the cost. And one of those ways is to purchase sites while we have federal dollars in order to not have to pay leases next year. So we're in negotiations for smaller sites, none of which are in Bloomington. Our goal would be to relocate some of the seniors and medically fragile people who are either currently in hotels in Bloomington or Minneapolis to those new sites. So we are diversifying our portfolio, if you will, but it is not expansion, and we do not have any further Bloomington sites that are currently being pursued.
Thank you, David. There's kind of a follow-on here that I think makes sense to take next, which is, do the hotels have on-site social workers to handle the needs of the homeless, including drug intervention? And Mike, would you like to take that one?
Sure. Excuse me. Yeah, so our hotel is staffed with a minimum of 3 individuals who we call shelter advocates. Their roles vary, but are similar to what I think folks understand to be a social worker's role. We also have a contracted social worker for about 15 hours a week. And so they are really focusing on the housing outcomes piece. We are partnering and have been partnering with House of Charity, which does treatment, and they have been coming on site a couple times, for a couple weeks now, and starting to build rapport, have conversations about Rule 25s, which are the chemical health assessments needed to access treatment for folks without insurance that would cover that. So the long answer for probably what was needed was a short answer, but with yes, we do provide those services.
Great, thank you. That's really helpful. And I think worth noting that there are other services that the county is also providing, wraparound services throughout their shelter locations, both here in Bloomington and in Minneapolis, and other communities. David, did you want to say anything about that?
Yeah, I mean, that's absolutely right. We've actually, things were stood up in a crisis response, and we borrowed more than 300 people from across Hennepin County have taken on shifts at the hotel. So staffing it appropriately has been the goal throughout. And more recently, we've really been trying to build the team around housing. We've moved, I think as of today, it's a little over 90 people have been moved out to permanent housing. And we've really ramped up those efforts. And that's where we want to pivot to. That's where we want to get to. That's where we want services to be focused on. It's just not just maintaining people in these spaces, it's getting them onto somewhere of their own.
Thank you.
Heather, if I can just add one more thing, kind of tying back to some of the earlier comments about housing instability, the kind of the significant reduction in the cost for a standard hotel room has meant that there are a lot of people who are using hotel rooms and self-paying for them, and using them as a housing opportunity or option in the current kind of climate. That's a reasonable thing to do. And so it's important to realize that, like, St. Stephen's is operating a hotel program. The county has a couple, but there are a lot of housing unstable individuals across the hotel system. And before the crisis and before these hotels were stood up, there were a lot of people sleeping in places that were not meant for human habitation, in the park and rides, in the Mall of America, in the parks. And St. Stephen's has, as one of many outreach teams, has been engaging with those folks and counting them in our biannual point in time counts. And so this is affording an opportunity to have an intentional conversation, but it really is part of a bigger picture that I really want to emphasize that it's not only the hotels that are having issues around homelessness because of the programs that we're providing.
Right. And I think it's important, again, as an economic issue, to note that if you're paying $50 per day for a hotel room, you're paying effectively $1,500 a month for a unit, and it's difficult to find a unit at that level of affordability in Bloomington right now. So again, I think it illustrates really well the kind of affordable housing crisis that's layered on top of this unsheltered crisis that we're seeing right now. The next question is about resources, contacts, or ideas to provide accessible storage space of donated supplies to people living in an encampment. And I'm going to throw this one to Nicole, because I'm not sure. I know you probably offer some supplies for your program and maybe have some storage space, but do you know of other resources here?
I'm going to throw this to Krista or Mike. We don't. We're not going into the encampments as much. It's not in our service area.
Yeah.
So.
Well, and I think Mike would be the one to answer then the encampment question. Yeah. Thank you.
Yeah. Okay. So the question I'm looking at: can anyone suggest a resource, contact, or ideas to provide accessible storage space? I know I can't.
This one's tough. Yeah. I know, it's my garage. I mean, literally, that's how it is in my neighborhood where I'm working with an encampment. It's my garage.
Yeah, the thing that this will be my plug to really, before you go to donate something, really make sure that it's something that is going to be used and useful at an encampment, because especially at the large encampments that we saw at the Wall in 2018 or in Powderhorn, like, donations and the excessive donations generated rodents. It generated just a huge headache. It generated controversy. It generated all of these things that were not useful and were much more of a burden than they were a benefit. So.
Yeah. And I would just add that my experience, again, organizing help for the encampment near where I live, is that having somebody who's willing to kind of be that central point of intake and then carefully kind of go through, like, we need coats or we don't, kind of exercise, I think is really helpful for people. So if you're interested in helping, please reach out first and see what's needed before you donate items. Thank you. I'm going to scroll down here because we got a few more questions here. Let's see. I am curious, from a policing perspective, how do you manage the business-residential relationship when homeless enter Bloomington? What is the process? Erica, do you want to?
I guess, I mean, we don't have a formal process, I guess. When we have So I deal with businesses in the city of Bloomington. My partner in crime prevention deals with all the apartments. I deal with all the residents west of 35, and my partner deals with all the residents east of 35. So when we get, I guess I don't even know if I'm answering the question correctly. But like I had mentioned, we do get spillover from some of this crisis into our neighborhoods, into our businesses. I've been dealing with a lot of business owners, employees from businesses around certain hotels, just having questions or concerns about increased crime in their area or in their business. And I guess it's just more, what can we do to keep this safe? Some people are putting some barricades around, whether it's their parking ramps or securing their doors better, or hiring security officers to deal with some of the increased issues brought on by this crisis. If I didn't answer your question, if you want to, let me know, but or if someone else has a better answer for that. But basically, we're always aware of the issues and how they're spilling over into the rest of the city, not just the actual shelters. So we're addressing that, especially if they're brought to our attention. We get people calling us and emailing us all the time about issues.
Yeah, thank you, Erica. Here's a question. I hear more and more people talking about how secure housing is critical to personal health and well-being. Are there any efforts to rethink how we design public health programs to include more than just physical health issues? And this is a great one for Faith to talk a little bit about. Sorry to put you on the spot. But I'm going to ask you to speak to the recent work that you've been doing on racial equity as a public health issue, and kind of expanding our ideas about how public health is impacted by these disparities in the community that are economic and racial. You want to talk a little bit about that work?
Thanks, Heather. I always enjoy being put on the spot. I'll take a stab at it. No, I think it's a good question, and one I'm happy to speak to. Over the last several weeks, and actually just last night, the City Council heard some staff recommendations and presentations about how we can start to address racism as a public health crisis. And so while in that particular conversation, the focus is on race, what we know is that these sort of social determinants of health, which housing or sort of the lack of housing is a significant one, really influences overall health and well-being. And so in the city, some of the things that were talked about before with the opportunity housing orders and things like that, we're trying to address those issues, but we're also cognizant of the fact that there's sort of layers of issues there. And so there's still low income populations are more impacted by those things. And within that population, there's a greater number of Black, Indigenous, and people of color. So there's a lot of intersectionality in this work. And so we are hopefully in the future, we'll be bringing together different stakeholders from various sectors to think about how do we problem solve together to address those underlying issues, and housing is definitely one of those things that's front and center in that conversation.
Thank you, Faith. That's really helpful. And I should add that from a housing stability standpoint, we know that from a public health and educational attainment standpoint, one of the most important things that a child can have that ensures success in school is that they have stable housing. And so when we have so many children who are unstable in their housing right now, that's a real challenge. Nicole, did you want to add anything to that part of this conversation?
I think Faith did a wonderful job.
She sure did.
Yeah.
Any other thoughts about that? Okay.
Go ahead.
One
Michael.
thing that
was one thing that was noted by Krista was that the state was recently had their application approved for Medicaid billing, and so that is a way that the state is looking to fund housing services, housing stabilization services for folks that need them. The reality has been that it's very cumbersome to get enrolled and be eligible to do that, and time consuming, and we're not entirely certain that agencies like St. Stephen's or Our Saviors will actually be able to benefit and make the financial pieces work to be able to utilize those. So that's
Thank you.
a good thing and a concern.
Thank you. And I just, let's see here. The last question in the chat right now, so if you want to put some more questions in the chat, go for it. We've still got about close to 20 minutes left here on the on our meeting. Earlier, it was mentioned that there are no official organizations for people experiencing homelessness in Bloomington. What would it take to change that for the future? I think this is kind of a little bit of a gray area. I know VEEP offers quite a few services for people who are experiencing housing instability, not necessarily homelessness, but so VEEP is one resource in Bloomington and a very good one. But you know, I would ask Krista to go ahead and speak to this. Krista Gibson, who's not on the panel, but is part of Our Savior, I believe, right, Krista?
Yeah, and I'm sorry, I have laryngitis, so it might be very hard to hear me, but I'm gonna yell. I think the one thing that we have to note as the public is that when both Republicans and Democrats decided they wanted to end veteran homelessness, they did. Veteran homelessness is primarily ended in Minnesota. When I first started as the shelter manager at Our Saviors in 2014, we had 20-some veterans in our shelter, and we rarely see them anymore. And what made that work, what made that effort work, was money, cohesion, and coordinated effort. Until we get coordinated effort from everybody, bipartisan coordinated effort, bipartisan recognition that homeless lives matter, and money, we will not end this. There will be homeless people in your parks sleeping there. And just like in St. Paul last night, there will be fires. There was a fire in an RV last night that injured people because they're homeless. This will happen in your community if we do not start addressing this with money, coordinated efforts, and bipartisan cooperation. End of my spiel.
Thanks, Krista. The last question for this evening is, so what is Bloomington doing to help address the homeless needs here, and how can residents help these efforts? Well, that's a great question to end on, because I think there are a number of things that you can do right now. And I know that we have a few state legislators on the call this evening who I know are very interested in hearing from you on this issue. We have several council members on the call this evening who would be interested in hearing your thoughts about this. And clearly, because Bloomington is experiencing this in a deeper way for one of the first times in its history, I think it's a good time for us to have that community conversation. And this is kind of a kickoff to that this evening. So there's much more thinking and problem solving left to do. And I want to hand it back to the mayor, who I know is going to ask some of our elected officials who are on this call to speak some final thoughts. So thank you very much for participating this evening.
Yes, thank you. Thank you, Heather. And thank you everybody for participating this evening. It was a great conversation and very informative and enlightening and frankly, kind of encouraging to hear so many people with so many good questions, ideas, and just the passion and the energy around what is absolutely a difficult and hard discussion and a hard problem in our community. And this is where it all starts. This is where the solution starts. So I appreciate everybody being here tonight and being part of our discussion. We in the city of Bloomington, the question about what the city of Bloomington is doing, you are fortunate to be represented by a city council that has this at top of their mind with many of the things that we do. And we have 4 of those council members with us tonight. Councilmember Dwayne Lohman, Councilmember Patrick Martin, Councilmember Nathan Coulter, and Councilmember Jenna Carter. And they do outstanding work, and they were, I will give them the credit. They were the drivers as they came on board, they really started to kind of coalesce around what do we want to do, what do we want to tackle here in the city of Bloomington. These were the folks that really kind of coalesced around the idea of of the affordable housing crisis in Bloomington and across the metro. And then more specifically now, as we talk about homelessness in Bloomington, and I tip my hat to them. They've done an outstanding job with it. They've been great leaders in the community. I want to turn it over to them, see if they have anything to add. The way this works, gang, because you're automatically all muted, you got to raise your hand. You know how to use the raise hand feature there. Raise your hand and either Faith or Heather will let you in. And if you wanted to add just a couple of quick comments, that'd be fantastic. Love to hear from you. I think you got to do the official raise hand, Jenna, not just raise your hand, but you got to do the raise hand. And,
yeah, if you go down to participants and you just click on that, you'll see that you can actually raise your hand next to your name. So that's how you do that. But if you just raise your hand, I'll call on you.
Okay, Heather will just call on you if you just wave your hand a bunch.
I'll just let you get away with it. Yeah. So Councilmember Carter, I will unmute you. Oh, I thought I had all the power. Go.
Great. Thank you so much, Heather. So this has been an incredible conversation. I'm really grateful to be here tonight. Back in 2018, when I first started to consider running for council, one of the biggest reasons why was because I had been talking to one of the school social workers at the time, and she told me that they had around 280 students who were homeless. And I, as a mom, I was shocked. And as a public health professional, it made me so concerned. I mean, I was losing sleep at night. I was very active in the Bloomington Housing Coalition, working on affordable housing policy. But I just, I don't think I realized the magnitude of homelessness, and especially youth homelessness in Bloomington until that moment. And I started talking to more and more people about it, and nobody believed me. I mean, people asked me to see, they were like, show me the data. They did not believe me. And so this was a crisis before COVID. And I appreciate everybody who brought that up. And I think it kind of got lost in the affordable housing conversation, but it was always simmering underneath the surface. And to me, in my mind, one child homeless in Bloomington is a crisis. And so COVID has obviously exacerbated the issue. And I want to agree with Krista. I mean, I think that key to accomplishing what we need to accomplish, which is it's a huge challenge in front of us. I mean, history shows us that the most resilient communities are when communities that come together and that work together toward a common goal in relationship. And I think if we come together, work intentionally with each other, bring in residents who are interested and engaged, bring all the resources that are available to bear, that we can actually start making a dent in this issue. And I know I'm committed to it. I'm so grateful to be on a council with other colleagues who are committed. We have amazing city staff. Thank you, Heather and Faith, for organizing this event today. And then I want to give a huge shout out to our panelists, David and Mike and Nicole and Erica and Representative Howard, for all of the work that you guys are doing. I mean, I really don't know what we would do without you guys. So thank you.
Thanks. Thank you so much, Councilmember Carter. Let's see, who else do we have here? Councilmember Lohman.
Thank you. My little button disappeared. So I think one of the things that I've certainly been a participant every couple of years over at the box vigil. The young folks get together over at Oasis and kind of remind us as a community about the importance of homelessness, especially among young folks. And I think the mayor has really caught it well, but I think that, this is an opportunity for us to listen, and it's for us an opportunity for us to take action. And so I think I'm not going to say anything more. I'm going to leave it at that. Thank all the panelists, but we've got some work to do. We need to roll up our sleeves and get to work. Thank you.
Great. Councilmember Martin.
Thanks. Just real quick here. I just want to say I appreciate the kind words from the mayor, but I remember when he was out on the campaign trail, the theme that kept coming up again and again was alignment. How are we taking groups in the city that are doing great work and pointing in the same direction? And boy, oh boy, when a global pandemic hits real quick in a first turn, all of a sudden alignment becomes way more important. So I know my council colleagues and I are excited to continue working on this, but I do want to give a shout out to the mayor because his leadership has been a big deal. And alignment, I think, is exactly what we're all looking at on our computer screens right now.
Uh-oh, what happened?
Is Nathan still with us?
I think he had to leave. I don't see him anymore. I see, is it Senator Wickland?
Yep, I think absolutely. If we can, if Senator Wickland, I'd love to hear from her because again, she's been an outstanding leader at the state level for Bloomington.
I'm a little embarrassed because I'm trying to find her now. Hang on.
I'll find her. Hold on. I think I can do it. Hold on.
Okay.
I was wrong. I can't do it. Oh, I did. There you go. No.
Did you get her? There she is. Got it. Did I get it? Oh.
You do it.
So close.
There it is.
I think we're doing dueling unmutes here. Okay, I'm unmuting you. There you go.
Sure. Great.
Yay.
Thank you. Yeah, this has been an excellent session, and I appreciate hearing from all the panelists and then seeing the comments and the questions coming from those who are watching. It's really been informative to me, and I appreciate having the opportunity to learn from all of you. It helps me to have a better picture of what's going on in Bloomington and what the key needs are. I think as we look forward to the next session, which starts in January, this helps me understand, kind of what the huge priorities are that we're facing to address emergency problems and, address this long term. And we may have short term things we need to do, but then also we need to look at the long term solutions that are definitely needed, and that we need to look across many different areas to provide the full solution. It's not just housing assistance, but it's also looking at human services. Are we providing enough mental health services in communities? And are we providing enough assistance or help in terms of economic development and stimulating new job growth as our economy gets better, hopefully in the next year. And so more people will be able to find work that can support them. But I can see we have a huge amount of work to do in people having the ability to access stable housing. Being on the school board previously to being in the Senate, I could see the impact of instability on our student population, and it's been something that I hope that we as a state begin to address more directly in funding and policy. So thank you for letting me have a chance to speak tonight. Thanks.
Thank you.
Thanks.
Mayor?
I just want to wrap up by echoing Councilmember Carter's thanks to our panelists, to David and to Representative Howard and to Mike and to Nicole. Thank you for the work that you do in our community. Very much appreciated. We really, really do appreciate it. And thanks in particular to our city staff who put this all together. Faith, Heather, Erica, thank you for your presentation tonight, the work that you do. Work you've done tonight, but the work that you've been doing for the past few months on this. And I know this is a tough one, and you've done outstanding work. And I've heard that from more than one person about the outstanding work that you've done. So thank you so very much. Faith and Heather, thanks for pulling this together. This has been a great conversation. Really do appreciate it. Everybody else, glad you were here. I really am. This is what a community conversation is all about. I really do appreciate your being here, taking the time to be with us. Thanks much.
Thank you. Good night.
Good night, all.